Good afternoon, I'm Karen Holmes Ward. Later in the program, efforts to bring life sciences to Roxbury. But first, October is Breast Cancer Awareness Month. And for the next few weeks, we're going to hear advice about prevention, the importance of early diagnosis, and new treatments. But there are also questions about racial disparities. ABC's Deborah Roberts has more on the diagnosis and mortality gap between Black and white women and how breast cancer has touched her family.
Breast cancer awareness is paramount for my sisters and me. In 2009, we lost Benny to the disease at age 56. Then, in 2019, Janet was diagnosed too. After chemo and radiation, thankfully, she's now cancer-free. But our worries haven't gone away. Bernadette Osen knows that feeling.
My mortality was right there in my face.
In 2021, like Janet, she was diagnosed with invasive ductal carcinoma, and she soon learned that age and lifestyle are not predictors for breast cancer.
I don't eat red meat. I was walking 4 miles a day.
Then another sobering discovery. Black women are 41% more likely to die from breast cancer than white women, despite having similar incidence rates.
Incidence rates of breast cancer among Black women, coupled with the fact that Black women are more likely to get biologically aggressive patterns of the disease, has resulted in a widening of the mortality gap.
For 20 years, Dr. Lisa Newman has been researching key socioeconomic, genetic, and systemic race disparities that compounded stack high against Black women.
We have done leaps and bounds with breast cancer research. It is not a death sentence. It is actually a life sentence.
And as Bernadette, a single mom of 2, knows, early detection is key.
My treatment's done. This course is run. And I am on my way.
After chemo this summer, she's turning the page. But that's not the case for so many other Black women, Newman says.
Poverty rates, likelihood of being underinsured, these all result in delays in making a breast cancer diagnosis, inadequate treatment, incomplete treatment.
So survivors like Donna Robinson, in remission 11 years, have found a calling.
The story that captured me was a young Black girl that was going through chemotherapy, and she didn't have transportation, and she would go for her chemo treatment and catch the bus and ride home.
In St. Louis, Missouri, where the Black-white disparity in breast cancer death is among the 5th highest in the country, Donna's giving new meaning to purpose-driven.
Treatment is hard. It's hard emotionally, it's hard physically.
She's a volunteer with the American Cancer Society's Road to Recovery, a program pairing cancer patients in need of transportation with drivers like herself.
If one person's heart is a little lighter, I've done something that makes volunteering worthwhile.
But not all disparities are financial.
Systemic racism affects all aspects of society, including public health. And it unfortunately remains true that there are some pretty appalling disparities in delivery of breast cancer care.
My first experience was not enjoyable.
It's why the Mitchell sisters out of Arkansas are embracing the Grabbing Their Girls campaign and taking on health together.
It is a scary thing to go to the doctor for anything. Definitely to go for screening for cancer. And no matter what the outcome, no matter what the news, having great support there is key to everything.
We want to thank Deborah Roberts for sharing her family story. In the Boston area, there are efforts to reach out to women of color who are fighting breast cancer. Joining me now is Nakia Clark. She's the Director of Patient Services and Outreach at the Ellie Fund. Welcome, Nakia. How are you?
Thank you. Good, and you? Glad to be here.
I'm glad you're here with us. You know, you're a breast cancer survivor and a former patient of the Ellie Fund. Tell us, how did you find the Ellie Fund and what kind of support did it provide for you?
So I found the Ellie Fund actually through my mom, who had metastatic breast cancer, and she had received services from the Ellie Fund years prior, so I knew of them. And when I had the same diagnosis, I knew where to turn because I was in need of childcare for my son while I stayed home to recover. And I received childcare as well as gift cards for the groceries so that I can provide food for me and my 2 children.
Nakia, what did that support from the Ellie Fund mean for you as you were going through your treatment?
It meant a world to me because I was at the point where I was going to keep my son home and try to manage my recovery with him home because I knew that financially my income was shortened and daycare is very, very expensive. So it came really good for me so that I can have my son go to childcare and still be able to stay home and recover.
Okay, so now you're the outreach director at the Ellie Fund. How do you find patients that could use the kind of help that you received?
So there's an array of things that we typically do to find our patients. The most common is through their hospitals or centers where they get referred to us. Most recently, this month, we've launched our self-referral application. So now patients can go online and apply for our services without the help of the doctor or social worker, which hospitals are so bombarded with patients that this empowers them to go onto our website and be able to apply for services on their own. On top of that, I'm sorry?
Nope, go ahead. On top of that?
On top of that, we are reaching out in the communities. We go to community events, talk about the Ellie Fund, shows like yours where we're going on and explaining what our services are to people so that they are more willing to either go to their doctor, call us directly, or go online on their own to apply for our services.
It's important to get the word out. Stunning statistic here, Boston ranks 5th in black-white disparity in breast cancer mortality out of 41 major cities. What are some of the reasons for the disparity in death rates, do you think, between black and white women?
It's the lack of knowledge. So women are not aware of how to have self-exams, how to go to the doctor, even advocating for themselves when they feel like something's wrong. Most likely, I would say the trust issue. Historically, Blacks have not had good outcomes going to their doctors, and there is still that lack of trust. So they don't go when they feel like something is wrong. And believe it or not, in 2022, we still deal with racism, and we don't get the same care as a white woman would.
Black women in Boston who are on Medicaid are 2 to 3 times more likely to delay breast cancer treatment than their white or privately insured peers. How can we change those numbers?
We can change those numbers by educating Black women on the importance of mammograms, the importance of breast exams, and also advocation. You have to really, and even in my case, you have to advocate for yourself. You have to go out there and speak. If you don't get the answer the first time, then get second opinions. And I think with that, we'll get better outcomes for women and not be less. We wouldn't have the mortality rates that we had if we had the more education and more advocacy for ourselves.
Again, tell our viewers, tell women in our audience, people, families in the audience about how they can reach the Ellie Fund.
Yes, there are several ways you can reach us. Our website is elliefund.org. You can reach out to me personally at nakia@elliefund.org. You can also go to your doctor and tell them that you would like services from us, and they will connect you to us.
And if you're receiving treatment at a community health center, you can send the message through your community health center as well.
Correct,
That's
yes.
right. Okay, Nakia, thank you so much for joining us and tell us about the great services that the Ellie Fund provides. Take care.
Thank you.
Be well. Now, if you'd like to join the fight against breast cancer, there's another way to do it. Susan G. Komen is holding a More Than Pink walk on Saturday, October 29th. The walk will be held in North Point Park. It begins at 9 a.m. and you can register online. Channel 5 is a proud sponsor. You can find a link on our website, WCVB.com. Our own Mike Wonkum will be out there leading a team with his wife and family. So make sure you say hi when you get out there and see Mike. Up next, Life Sciences in Full Color, the new effort to bring people from marginalized communities into the field that's growing in Boston. The opportunities opening for workers who want in on a path to a new career.